Today we are covering one of the most critical legal and ethical topics on the NCLEX: informed consent. At its core, informed consent is built on four essential elements that the exam will expect you to know. First is disclosure, meaning the healthcare provider has given the patient all necessary information. Second is comprehension, meaning the patient actually understands the information. Third is competence, meaning the patient is capable of making a rational decision. And fourth is voluntariness, meaning the patient made the decision without coercion. The single most important concept the NCLEX will test is the difference between the provider's role and the nurse's role. The provider, such as a surgeon or physician, is solely responsible for obtaining informed consent. This means they must explain the diagnosis, the nature of the proposed procedure, its risks and benefits, any viable alternatives, and the prognosis if the procedure is not performed. The nurse is not responsible for giving this information. Instead, the nurse's primary role is to act as a witness and a patient advocate. You witness the patient's signature on the consent form. You confirm that the patient is the one signing it, that they appear competent, and that they are signing voluntarily. Your most crucial duty as an advocate is to verify the patient's understanding. Imagine this exam scenario. You are preparing a patient for a cardiac catheterization. The consent form is signed, but as you are about to administer the preoperative sedative, the patient says, "I'm still not clear on what the doctor is going to do once the camera is in there." What is your priority nursing action? The correct answer is to notify the provider immediately. A common exam trap is to choose an answer where the nurse provides more information, such as pulling up a diagram of the heart or offering to explain the procedure again. This is incorrect and outside your scope of practice. You cannot clarify information that the provider was supposed to give. Your job is to recognize the lack of comprehension and halt the process until the provider can re-explain and ensure true consent is present. Let's talk about special circumstances. In a life-threatening emergency, if a patient is unconscious and unable to consent, consent is implied to provide life-saving treatment. For minors, consent must generally be given by a parent or legal guardian. The exam might present a trick scenario involving an emancipated minor or specific state laws allowing minors to consent for things like substance abuse treatment. So be aware that exceptions exist. For a patient who has been declared incompetent, a legal guardian or someone with a durable power of attorney for healthcare must provide consent. Here is a simple phrase to help you remember your role. The provider must explain, but the nurse must ascertain. The provider explains the procedure. The nurse ascertains or confirms that the patient understood the explanation and is signing voluntarily. If that understanding is not present, you must stop and call the provider. By focusing on your role as a witness and advocate and recognizing the provider's sole responsibility for the explanation, you will be prepared to correctly answer any informed consent question the NCLEX throws your way.